Welcome to the Orthopedic Indications channel, where we discuss medical education for medical sales consultants and reps. Okay, so you've kind of heard us talk about this. When is surgery needed? It is instability cases, and Jan, feel free to chime in here if I'm saying to help summarize this. But if things are really displaced, we already said the fibula you can get by with some displacement, but things that are way out, unstable mortise, so widened medial clear space, or this subluxation laterally, the syndesmotic injury, where you see widening, bimalleolar, trimalleolar fractures. I think generally speaking, if it's a bimal, we're fixing it. I think, is it absolutely every one? No, that's not true. But I would say for the most part, most bimals get fixed. Open fractures obviously get surgery. Intra-articular displacement, for example, like that supination adduction injury, I'm much more aggressive if I see an SAD fracture to get a CT scan and think about fixing them, because I want to get that cartilage just right, even if it doesn't look inherently unstable, so to speak. And that's the idea of like looking at things. If you're a rep, looking at the ankle mortise, understanding what congruent and uncongruent looks like, and that's helped driving our decision making for surgery in these cases. Anything you would add to this, Jan?
No, I think, my big thing is I have one of my older partners and mentors will say like, order an H&P. And I
Yeah,
think that's
yeah,
these things, like you said, like it's an open fracture, not an open fracture. Or they have painful when they walk, or like, no, this was kind of like I thought that was an ankle sprain, but my husband or wife or partner said, you need to go get that checked.
yep.
I think that'll help you kind of, gauge which path you want to sometimes go down.
Yeah, it's so incredibly, nuanced, and it's amazing what you can pick up by just talking to the patient on a lot of these things. That's for sure. All right, and this is like, here's a case, here's a bimal, and this isn't like jumping into it, but just to show the differences, right? So you kind of see the extremes. We've showed some normal X-rays. Now you can see what looks abnormal, and this is a case where you're like, yeah, not only does that need surgery, that needs a reduction, right? And so this would be one in which you'd look at and say, this is a case that needs.
And, and I and I and I would stress this also needs a reduction, fairly quickly.
Mm-hmm.
Maybe not emergently in the next like 20, 30 minutes, but you don't want to keep this overnight like this, because if you look at that middle image, especially with the mortise, you can see where the medial skin was going to be under a lot of tension. And patients who are splinted like this tend to have a lot of, or could have, skin breakdown medially, and that could be a disaster.
Total disaster. Yep.
So this is one where, is for the residents and medical students out there, who are, listening to this, this is one you need to put the talus under the tibia.
Yep.
That's
And it's always more than you think. You got to give it more of a J than you think. We call it a J mold. I don't know if that's what you call it, but it's like the foot should almost be pointed towards the ceiling when you're done with it. And
yeah.
and that seems aggressive, but it's honestly it's what it needs to hold that in the right position. It's always more than you think. The other thing on this, in that middle picture, is like I think it really emphasizes what you were saying, Jan, about the subluxation, looking at the lateral edge of the tibia, looking at the lateral edge of the talus. Like this is extreme, right? Extreme situation, but you can see how that, I can draw it out. You can see how it really, here's one edge and here's the other edge, and it is way out. This whole distance is very displaced.
Yes.
But that's what we're kind of looking at when you're looking at some of these more subtle injuries. All right. So that's the summary: anatomy, classification, talked about mechanism, how they present, and then conferring stability. And I think there's a lot of things to know and to think about when you're thinking about these particular ankle fractures.